Task 11 is a running subcuticular wound closure. We will again use the Limbs and Things small wound closure pad with a 10 centimeter elliptical defect with about a 5 millimeter depth in this incision. In this case, the pad is oriented parallel to the edge of the bench, and I'm right-handed, and I will close the wound from right to left, which should be the rule of thumb. We do not have targets marked on this model, as this is really a freestyle exercise. However, I will show you the important aspects that we expect to achieve a good performance on this model. When you will be performing this, we will have you use a 4-0 monofilament suture named Capricin in an 18-inch length with a cutting needle. You can see that this is colorless and is very difficult to see. Therefore, I'm going to use a 4-0 nylon suture that is not absorbable as my demonstration suture, as it will be much easier to see. We will start in this corner, and I will point out I'm using DeBakey forceps. On skin we should be using Adson forceps with teeth. However, on this particular model, the smooth forceps work better. I like to anchor a stitch deep in the subcutaneous tissue in a buried fashion, close to the corner, as shown here, taking one bite of really the deeper tissues on either side. I will point out on this model, it is prudent to take bigger bites than one might normally expect, so that the suture does not pull out of the tissue. We will then instrument tie using usually our surgeon's knot, followed by 2 squares. Actually, we'll tie a total of 3 squares for a total of 4 knots. We will cut that tail off very short. We will then start by taking very small bites out of our corner, right at the dermal epidermal junction for the best cosmesis, as shown here. Loading in the wound as we saw previously, and taking 2 relatively small bites out of the corner, and then pulling up as shown here, and we will have a reasonable closure of our corner. We can then start taking slightly larger bites, and we want to travel directly across as shown here. My next bite will go directly across from where it exits on the opposite side, holding my needle with my forceps, loading within the wound as shown here, and then pulling up every time I have 2 bites achieved. Again, pulling tension along the wound instead of across the wound, which tends to be more traumatic to the tissue. Everting the tissue to achieve our bites and to achieve visualization. We will make our way down to the other side of the wound. As we approach the corner, we will start taking smaller bites, and we will keep pulling as we go, such that we get good approximation of our edges. In these final couple of bites, our bites will be even smaller, often difficult to place. And as this wound almost looks closed already, we have to artificially open up this end and take bites into the corner. We will take 2 such bites and then perform what's called an Aberdeen knot. This is performed by finding the loop between the final 2 throws of the suture, placing the first 2 digits through that loop, and you can see my needle is still locked in place in the needle driver. I will grab that strand And it does not make any sense to pull on this top strand that's simply attached to my needle driver. Instead, I will pull on this lower strand, which cinches down my knot, as shown here. Again, reach through and grab the strand that's attached to the needle driver. Cinch the knot down. Do that 2 more times, and on the final pull through, we actually pull the needle through the loop. And then we cinch that knot down with our needle driver, as shown here. We really don't need our forceps at this juncture. We can load our needle, hold up on the suture strand, and then come right behind it, taking great care not to cut our own suture with the cutting needle, but then to exit the skin beyond the wound. Pull up our suture, and at the last moment here, we just pull up such that our needle becomes, our suture and our knot become buried, and then we can cut at the skin level, and the exercise is complete. Pitfalls to avoid with this are really, as I pointed out, taking too small bites, especially in this model, will cause pull through and will not allow a good simulated wound closure. So I would emphasize taking a little bit larger bites than you might normally be in practice of doing. You want to bury this anchoring stitch such that it is completely out of view, and you want to perfect your Aberdeen knot, which I will show just superficially here on the pad by taking a few bites. And we will just pretend that we are running a stitch here. So that we'll have a loop to tie to. And let's just say we took a few more bites here. And we were going to close this one. Although I have a very short suture at this point, it will still illustrate the method where I reach through, I pull it, and I've created a knot. I then reach through again, pull on that lower strand, and cinch it down, pull on it again, cinch it down, and then on my final throw I reach through, I grab the strand, I let go of the needle, I pull the needle through, and then I cinch down the knot with my needle driver, reload, such that I can come underneath myself in the case of a subcuticular closure, and then I will bury my knot as such.